Okay, so we are going live for our adrenal fatigue slash chronic fatigue CME. We're starting a little bit ahead of time, and just real quick, I want to explain that we're going to dive right in because we're going to get this knocked out really quick. I have my baby needs to be seen today, so I had to move this up ahead of time. Obviously, you can't plan whenever babies get sick, that type of thing. So we are doing that, and he is overall well, just so y'all know, but we do have to. He needs my attention today, so we are starting a little bit early. I apologize. I also apologize because I know that the whenever I was setting this up, I was honestly just kind of playing with the platform and with the restream, and I didn't realize that I was like sending out times to people. So this was really confusing. Don't worry, guys. We are going to have a replay, so you will be able to catch that. But this is going to be a really great presentation. I'm very excited about it. We're going to have updates in functional medicine whenever it comes to adrenal fatigue, and we're going to be talking about some treatment plans, just some real interesting things. And then we're also going to be having on a specialist today. So that's something that I am excited to start bringing you all, just bringing on some people who are working in this to where you can, one, either get help, or two, just really see how easily you can implement this into your life. One of the things that I know in our private group, especially, I've had people having a strong interest for is, how can I give me some ideas for what I can do in starting my own functional practice or my own functional course creation or nurse healing. Depends upon your Nurse Practice Act, your state, your license, how you will implement this into your practice. But also, I know there's a lot of people who are really tired. And I'm definitely one of them today because baby was up all night. But there's a reason for that. I don't have adrenal fatigue. However, I have lived through this before myself. Most all of us have at some point in time. And we're going to talk about that. The first thing we're going to kind of talk about before we start diving into the slides is adrenal fatigue and kind of the controversy around that. So I always say, IFN is really an integrated, it's really an integrated platform. We honor conventional and holistic and functional interventions. So many individuals, many organizations really kind of bash one or the other. And I think both have their flaws and both have their really strong points. I do tend to favor more on a personal preference, more of the functional model, but that's not to say that I don't believe in conventional medicine and that I don't still at times recommend it even. So we're going to be talking about kind of the controversy around that. Adrenal fatigue is something that some will argue there isn't a strong basis for it, for the diagnosis itself. I'll tell you that most of that is based in the staging and the pure fact that many people can have, whenever we are testing people, and especially whenever it comes to cortisol levels, those fluctuate a lot. Just like even thyroid, that level can also fluctuate a lot depending on the time that you draw it. A woman's menstrual cycle there's a lot of things that can affect that. So there's always a little bit of variability, but I like to compare it to TSH because even in the conventional world, we recognize that, hey, your TSH is going to change based upon the time that you order it, time of the day, the person's circadian rhythm, because hormones tend to have a cascade. And we're going to look at the very end of this. I'm going to try to get through it quickly. We're going to see how incredible between cortisol in our body and the hormones and how strongly they're interrelated. So this is going to be a real great overview. We won't be able to go into quite as in depth, but if there's something that you're like, oh, I want to learn more about that specific pathway or that specific interaction, let me know and we can do a whole other CME over it. So that's what I like to equate that to. And that, yes, whenever we draw people's labs and we look at their cortisol, you want to be doing, just on a side note, you want to be doing saliva. It is the most bioidentical, and it is the most, it is not protein bound. Is really what I meant to say. And so it tends to be the best representation of what's actually going on for the individual. Yes, you can get so much variability that it can be a little bit, different from a person's, maybe that week they slept really well, maybe they had less stress, more stress. There is variability there, but we do see pretty strong trends. And especially whenever you correlate it to patient outcomes, think there's still a really good argument for calling it actual adrenal fatigue. But if you wanted to, you could say adrenal dysfunction, however you want to make sure that you're differentiating from this. We are not talking about Addison's. We're not talking about Cushing's syndrome here. You have to be careful to make sure that you're differentiating between those and that you're not diagnosing something like that when that's not, that'd be a wrong diagnosis if somebody doesn't have Cushing's or Addison's, and that's more of a conventional thing. We're not going to dive into that, but I just want you to see that, yes, there's a lot of variability and there is some controversy on how you should word this. The overall outcome and what we're trying to get for patients and for individuals, that's really what matters. And that's really what's important, and getting that patient feeling better and getting sometimes ourselves feeling better. Many nurses and practitioners do go through adrenal fatigue themselves. It's very, very common. So I just wanted to get that kind of out of the way. And now let's go ahead and dive into, I believe, the first part of our slides. We're going to talk about more of the staging. Okay, cortisol awakening response. So this is kind of the normal progression in the body and what goes on. So actually getting light so first thing in the morning, getting light to hit the back of your eye, essentially just looking, at light, seeing sunlight, especially. There is a difference between more of like UV lights or the lights that we have, in the house, blue lights and computer screen, those type of things. They do interact differently with our bodies than just the pure light from the sun. There are some alarm clocks, and I used to have myself, but it really lights up the whole room. And my husband and I usually don't wake up at the same time, but that try to simulate and get pretty close to not simulating, to being similar to the sun, waking up. And that is a really important thing because it triggers our body. It triggers the anterior pituitary, the adrenal cortex, and then cortisol is secreted. And we tend to have what is a normal, we're going to look at, abnormal, we're going to look at normal patterns here. We should have a pretty good significant spike. We should have 50% spike in the morning, and that should be the highest time that our cortisol is elevated. And then there's the negative feedback that from the cortisol triggers to the hippocampus that suppresses the melatonin secretion. And then it also decreases that cortisol awakening response. That's what CAR is. And, hold on 1 second, actually. So also along the line, guys, I love, love, love having interactions. So those of you who are live with us today, please don't hesitate to ask questions, comments, if you've had an experience with this, anything along those lines, because it really is, I think it's just so much more, people gain so much more from it whenever you are interactive, and you also learn more. That's proven through neuroplasticity, and the more you interact, the more you engage in more senses, the more you will get from that. So we are going to also, I still can't get the going live thing on Instagram completely right. You do not have to be an Instagram guru to do well. Let me just say that much. Okay, so Instagram, you are not, there it is. Perfect. It is there. Okay. Instagram is, okay, we're now live there. Instagram's not going to get the slides, but you can jump into our free group. I will send you all the message on that if you are wanting to. Instagram doesn't integrate into this very well. So you're still going to get the information, but you're going to see me talking about it as opposed to seeing the slides. So we're talking about the cortisol awakening response and the difference. Light hitting the eye, anterior pituitary gets stimulated, adrenal cortex produces the cortisol secretion. So who would we why would we want to screen individuals for the adrenal fatigue syndrome? So obviously some fatigue, that's a prime candidate, somebody who's really tired without knowing why they're tired today, because I literally did not get very much sleep. I have a little one at home. I have a little one still. And sleepless nights happen occasionally with babies, and they're still really fatigued. Most often we don't know why. So the other, they may be depressed, they may have chronic pain, GI or immune dysregulation. That's also a reason why you maybe want to screen for adrenal fatigue. Diabetes or metabolic syndrome, those individuals, that group is just a lot higher risk. Cognitive decline. So even like just being tired, it's harder to think whenever we're tired. Well, the same happens whenever our body cannot function well because of the high amounts of cortisol. And we're going to talk about that. Another thing is your hippocampus, which is your memory center, is really close to your to your response place in your brain. So whenever you have high mental, it also affects that. That's one reason why and stuff can affect our cognition and our ability to remember things and recall. So those just might be kind of red flags that could be what's going on. And then of course hypertension, they can have high blood pressure. That can be a place of intervention, even for a medication reduction specialist. So that's something that we've been talking about in our functional integrative medical practitioner course, and helping some individuals to gain that, because that is, I think, a really, really high need area. Many people want to get off their medications, but there's this perception that you could just wean you know, especially like an antihypertensive medication. You can't just wean off of it. It's not that you are addicted to it, you needed it for an underlying reason. But if you find an underlying reason for your hypertension, you can maybe come off of those medications. Some people it's weight, some people it's sodium, some people we have to dig a lot deeper. And in majority of cases, we have to dig. Adrenal fatigue might be one of those reasons. And then also cardiovascular disease in general. And same thing on Instagram, guys. Feel free to reach out, stop and ask questions. If you have any if you have anything that is in your life that relates to this, drop it down. We're happy to like a real conversation. I don't want them just talking to you all. Hey, Becca. Hey, sister. Good to see you. So differential diagnosis here is one that gets missed, cautious of, and screening. Honestly, kind of treat for mitochondrial dysfunction with that, because they do tend to go hand in hand. We'll kind of see why. Hypothyroidism. Now that's kind of funny, because even like our email where I sent out, you know, hey, we're gonna be going live, y'all. This is really for a practitioner who's, you know, I remember I used to kind of cringe whenever somebody would say that, you know, they want their thyroid check because they're so tired they know they have to have them, because people always tend to believe that's got to be my thyroid, or I'm gaining weight and it's got to be my thyroid. And their thyroid tends to be pretty normal. Even if you check, you do want to do the TSH, T3, T4, all of things, you know, not just a TSH. But so it was always, you know, whenever I was in still working full-time primary practice, you know, somebody would say, I know it's my thyroid. And I like kind of cringe, because I mean, I'll check it for you, but most likely it's probably not. It wasn't. But this adrenal fatigue is something that we should be assessing them for, especially in that scenario. Somebody comes back with, you know, their thyroid looks really, really normal, but also we're also going to see how this affects the thyroid. So somebody really specifically does affect that. So they can go hand in hand there as well, though. Autoimmune disease, Addison's disease, we already talked about that, depression, and that's just really to name a few. We could probably talk for a lot longer about things that can cause people to be tired chronically. Okay, I'm going to the next slide here. Okay, it takes a minute for it to change over. Staging. So stage 1, this is where we have, you know, our cortisol reading might be just like a little bit elevated. The total sum of the elevated DHA is borderline to is borderline low or low, but could still be normal. Stage 2, sorry, my slide, I clicked them. Stage 2, so this is kind of the transition from increased to decreased cortisol output in the morning, especially noon or afternoon. So you always want to do 4-point readings on these. And we have a slide that kind of breaks it down a little bit more, but you'll do 4-point readings with this testing. And they're either low to borderline low, total, I almost put that together to say tortoise. Likely normal with normal evening readings. The DHEA is borderline low or low. An increased possibility for pregnenolone still. We're going to talk about that here in a little bit and what can happen and how it specifically staying chronically stressed can directly affect your hormones. and make a huge swing and a huge difference in those. That's why almost anytime talking about correcting people's hormones or they know that they're hormonal, this is very, we're going to, more often than not, I want to say, I think for depression and anxiety, the statistics are closer to 80% of people either experience it currently or have experienced it. So it's really pretty common. And helping people through that is a big help on it. So increased possibility for the pregnenolone steal. We'll talk about that here in a minute, specifically what that is if you aren't already familiar with it. And it is a transitional phase that can be very misleading. So sometimes it may look like everything's really normal in this kind of stage 2 when really everything's about to really drop out or compensating well, maybe mentally, even physically. OPD, most of your patients aren't going to come to you whenever they're stage 1, when we can really start implementing prevention and get them off of smoking, those type of things. They're usually going to present by the time that they're in the 3rd stage, because that's when they start being symptomatic. Same thing with more of the adrenal fatigue. This is whenever they're really exhausted. And what's funny, not funny, haha, but interesting and can be confusing to clinicians alike, is that sometimes our cortisol is actually still very high because our stress is high, but we're really tired. It's because our body's not compensating anymore. So this is as the adrenal fatigue really progresses, and individuals may enter into exhaustion stage. This is where they can be really, really tired. The glands may struggle to maintain the production of cortisol, and you may see it kind of being lower in the cortisol levels. This is where we really have all the chronic fatigue, depression. Think about screening for this, but if they're sick all the time, somebody who is sick a lot, we know that stress increases our risk for decreased immunity because of that high cortisol. Just like if we have somebody on cortisol for a long time, or we have them, it can decrease their immune system. Same thing can happen whenever we are endogenously increasing our own steroids constantly. The energy reserves are really getting depleted. They may even say, like, coffee doesn't work for me anymore, those type of scenarios. I've been there before, especially after having my first kiddo and working the clinic back whenever I did, and it was a very high stress job. So individuals may struggle to perform for everyday tasks. Stage is the recovery stage. Adrenal glands in the body as a whole require rest and support for proper self-care. Reducing that stress levels and adapting to a balanced lifestyle and supporting the body, we can really kind of get things back into a normal shift. It does seem, this is just from personal clinical experience, I see a lot of patients, like, their recovery gets, like, even if they've recovered, it's like once they take a hit, they go back into that stage 3 a lot quicker. It's as if our defenses are, like, they can kind of regain some, but they tend to not be as strong the second go around. So that's actually, whenever we have our specialist here, our expert here in a little bit, and she works with, she's an expert, especially with women and with kiddos, I'll be interested to even ask her about, do you see be more common with the 2nd, 3rd, 4th type of things, because that recoup tends to be a lot harder and stressful. It can be different from a person's situation, right? If somebody is taking better care of themselves in the 2nd child, maybe not as much, but covered, you go back into that stage 3 symptoms a lot faster than you did the first time. Aging can make a difference on that. There's a lot of things. So this is what I was talking about, pregnenolone steal, and this occurs when the body is under chronic stress. It may prevent produce cortisol at the expense of other hormones such as pregnenolone, which is the precursor to many other hormones, including testosterone and estrogen. Women who are very concerned for their testosterone being low, we have to start enacting and taking care of ourselves, making sure that we prioritize rest and we prioritize not stressing. Gentlemen are very good, even we're going to focus a lot on women today, but I don't want to forget the guys totally. They're really good at fine and taking on a whole bunch, but because this is, especially in society, this need individuals, or they feel this need to always put on a strong front, they will keep pushing through, even though their stress is building up really bad. They don't allow other people to know because they don't want to break down that facade. I'm trying to be sensitive to this, but break down that, they're trying to stay strong, especially big, and you're totally fine. And obviously then we can go into, other things maybe be screening for somebody who has, erectile dysfunction at an earlier age, somebody who is really tired at an earlier age. They can't build up the muscle mass that they used to be able to. Those are our gentlemen that, we need to, and women, women also have low libido, can't build up muscle as well, those type of things as well. But these are all also red flags. As we're talking about this, there's more things that kind of come in that you should be screening people for. So, and the term pregnant steel was actually coined by Ray Sullivan. I believe I pronounced that correct. He's an MD. And so there's been, like I said, debate over this, but even this started within somebody who was a conventional medicine practitioner, which is really funny because a lot of us on conventional medicine who kind of switch over to. So we're going to make plenty of time to make sure that we discuss with our specialists today, our expert. So the cortisol on those first levels right there, whenever you look at actually get as be at higher risk. So that's somebody else who may be able that you want to screen for. Like I said, there is variation in the literature, and that's where, truthfully, guys, sometimes there's a lot of times I did patients in a functional model, and I've not gotten the labs. I've treated based off of, or intervened based off of symptom recall and the individual, their experience, their past medical history. If an individual, I individualize this. I know not every practitioner is going to say this, and a lot of people say, don't guess, test, and I'm not against that standpoint. If you can, people can't afford it. Cortisol stimulation test might be one that not cortisol stimulation test, but the 4-point test might be one that I can be expensive. It can be a few $100s for individuals, and a lot of the times I can intervene a little bit easier without that. So, okay, we have a couple of people who are, she popped off. Some people are joining. So I wonder where I put that link on there. Like Ivory Ellis. Go ahead and drop in the chat, darling. Let me look at our chat here, actually. And then let me know. Oh, keeps freezing. Non-responders, quarter of people are actually healthy adults and they don't have that normal response, that normal huge spike like you should. It's freezing occasionally. Okay, awesome. Well, not awesome, but I'm glad that it's just occasional amount. Thank you, words. Blunted CAR, so that could be seen in clinical burnout, self-reported health illness, personal hardship, or psychological stress, which I apologize for the S being missed on that. Elevated CAR, possibly an adaptive reaction to anticipation or compensation to chronic high stress. So especially if somebody they have a very high one in the mornings, they might be an individual. I'm certain if I would have tested myself during this time, whenever I would, have to get to the clinic and be there on time. Yeah. start seeing patients and not know if I was going to have walk-ins in that moment or anything like that. I'm sure I'm somebody that I probably had this big CAR because just the anticipation last guru. And it's funny because we tend to find when really he tells us from the very beginning how bad it's on our body and be that cognition. But that's we talked about it on the podcast. So Nurse Practitioners Lifeline podcast, you could drop that plug right there for you. But I really do love that episode just did. I feel like it was very called. So this right here, so I'm sorry, Instagram people, you cannot see this, but you can ask the link and I'll get you the link to the replay. You can see here the Genovia Diagnostics here, and you can see here the green is kind of our happy place. So we would like to see how it's higher in the see it very well myself. There we go. That's better for me. Okay. You can see here, so 7 a.m. to 9 a.m. should be your first the first reading that you have. I've had patients ask, or not patients, students ask, well, what about somebody who is a night shift worker? Really good question. Nobody really has a perfect answer for that. It is a difficult scenario to be in because they don't, that circadian really important part of testing this. Typically, I think what most practitioners do, what I like to do is you just let the lab know that they're not going to have their first draw at 7 a.m. It's going to be based upon their personal times. Whenever they're waking up within that 30 minutes of class as, kind of against the norm. But we have to kind of take it with a grain of salt because it is going to be different. However, see how bad those night shifts are kind of being on their body. Which is such a hard situation, especially for healthcare workers, because we need those night shift workers. Like we need those people. People literally their life rely upon them. But it is no doubt very hard on your body. You have higher CRP levels, inflammation. It's just really, really a hard scenario to be in. So 7 a.m., 11 to 1 p.m. should be the second. There should be a natural kind of drop off there. And then our next 5 p.m. it should be kind of slightly lower. And then by 10 p.m. to 12 p.m., that cortisol should really be fairly low. If somebody is kind of blunted and it goes more straight across, that's probably somebody who is in a stage 3 where they're like really burning out, or maybe a stage 2 leading into the stage 3. But one of our interventions is licorice, and you wouldn't, if somebody's straight across high on the cortisol, you're not going to get in the licorice. That's going to raise it. You're also not going to do that with somebody who has diabetes or in hypertension, unless they're well controlled. And you use your own clinician, not interventions, but your own discernment. So that should be kind of the normal realm that you'll see. I like Genovia Diagnostics. I like there's a lot. And you can see here at the very beginning, it talks about, percent increase. So expected to be greater than 50%. That is what you should see on it. And any drop them. Cortisol in the body. So this is a little bit review. We'll go over this really kind of fast because if you're a conventional practitioner, you already kind of know this. But blood sugar, it's like cortisol is important for it, and immune suppression, electrolyte balance, sodium retention, potassium, electrolyte. Naturally, as soon as you go into your streams, having connection issues. Man, I hate that. I'm sorry. I don't know what to do necessarily. I hope the replay does well, and then we can record and give it to y'all. If not, we'll do another Zoom. And everyone get the information. So thyroid suppression, bone and collagen formation and suppression. So that's really important. If you have ever worked a night shift, such as myself, I will tell you my skin looked worse than it does now over a decade later, whenever I got out of doing night shift work as an ICU nurse. And I had the one and only huge crease right here on my face. And that was part of it, I am certain, because that cortisol was really high and my shift work had my circadian rhythm all messed up. So bone and collagen suppression formation also. gets affected. We're about halfway through our slides that I wanted to get through, but I really want to have plenty of time to have our expert on too. So this is an example of the 7 point. Oh, we already went over this. That's all kind of, you can see your DHA there too, though. That's all kind of review. I kind of already went over that. I get ahead of myself in my slides sometimes. So the fourth sample, the 10 p.m. is an indicator, and it's a bit more because that's one that I really tend to look at. Obviously, your first one, if it's really low, then you know that the stage 3 is burned out and they're not even having that spike anymore at all. Like a real phase, right? Like we use that term interchangeably in regular life, but it can literally be where you're burning out, like your body's not making that cortisol anymore and you may be really low. But the fourth sample is another important one to look at. So stress, exercise, ETOH, those may cause alcohol, may cause elevated evening levels, all of those. Exercise is a pretty nominal effect on it, but it does make a spike. And if somebody is low, that's whenever it really is oftentimes important for somebody to work out in the morning. And that's why a lot of the times, many people say, myself included, that, work out in the morning and I feel so much better the entire day. The days that I get, my baby keeps me up all night, I have to have that morning workout. Have to. It is a non-negotiable for me because it's going to allow me to have that natural spike in result, and to me, it's a huge difference in it. Plus, breathing fast, and that's actually kind of a form of breath work. It's getting more oxygen to your brain to think better. I mean, there's a lot of reasons why. Get your blood going, nutrients pumped throughout your body better, more oxygen throughout your body. I mean, there's a lot of reasons, but that is a significant part of it. Insomnia is often associated if that elevated fourth reading is high. So that makes a lot of sense. Even if it's just a little bit out of range, if somebody has insomnia, that cortisol being elevated there is a big difference, makes a big difference, even if it's just in a little bit like the yellow and not truly in the red phase yet. Diabetes, cardiovascular disease, hormonally driven cancers, and osteoporosis. So those are also things that we may want to screen for adrenal dysfunction. Okay, elevated levels of DHEA. These are other things to be thinking about in the interplay. PCOS, adrenal hyperplasia, dreamers, which is rare, but something that you don't want to forget, right? You don't want to forget about possibly screening for. Supplementation and endogenous lower levels common with age. Cortisol, HA naturally to the age of 25. So it will naturally decrease as on. However, too much of a decrease obviously is not expected, not within a normal range. Associated with immune dysfunction, cardiovascular disease, arthritis, insomnia, we're kind of went over all of that. So the ratio there should be more of a 5-to-1 on the normal ratio. So you want to have a good ratio. A decrease, that means more catabolic stressors, and that they're elevated, it's more of an anabolic activity. And then another thing is the hypothalamus pituitary adrenal axis. I apologize, that's XIS imbalances. So, a couple of errors there, sorry. But DHEA is actually, as opposed, in opposition to so many things. I mean, I think, it's really interesting to bounce around there, but it's really interesting. I love how there's like a yin and yang in the body. I mean, you see like in Asian medicine and culture, the yin and the yang and the balance there is so important. And I feel that I wish we had more of that in Western culture. And it's awesome because you can see it echoing in so many different parts of the body. DHEA to cortisol, DHEA tends to be more anti-inflammatory, antioxidant, protective, the neurotoxic effects that corticosteroids can have in our body, but we need both, right? But we still have to wake up and have that stimulating response when we first wake up. And so both are, I see it in like fruit. People bag on fructose a lot. Well, fructose has the anti-nutrient, but we have the fiber which combats that in a whole fruit. Whenever a fruit is whole, it has the fiber that helps prevent that spike in the blood sugar and prevents the anti-inflammatory effects of the glucose. And so it's always so beautiful to see the synergies there. I think that's a really cool thing. I should probably find some scripture on that. Already talked about that. Okay, so treatment. We are going to, now, disclaimer, I'm a provider. I am not your provider. And if you are a provider, you need to use your own discernment if this is right for your patients. There are a lot of things that we are not going to necessarily go into. This is in the full course. We don't have time here in this one little CME to be able to really dive into deep on the possible side effects of these medications, the right person, right time, all of those things. So use this with, this is an educational purpose, but it is a really good, standing board and starting place for a lot of people. But just know that, right? We have an entire 48-hour course over functional integrative medicine, and this all ties in. Like, you're going to have to be thinking about GI health. You're going to have to be thinking about hormones. I mean, there's so much inner plays in this. But treatment in general, kind of in a nutshell, stress reduction is a very important part of that. So meditation, imagery. I love doing cognitive neuro-linguistic imagery, and that's why I kind of teach in our program, because I think it's very effective for helping people at all over levels. So seeing themselves being different, tying neurolinguistics to other things, doing cognitive behavioral therapy to help people be able to look at things more beneficially. Even, I talk a lot about multidimensional view and 3D, like having cardinal vision versus multidimensional view, and how like God can be there with us as long as we have that view. I mean, all of that is important for stress reduction, and why, faith-based interventions can be very, very helpful for individuals who that resonates with them. Route, we talked about that a little bit before. Bonus points you can drop in the chat when you do use it, when you don't use it. Sleep hygiene, so minimizing tech. We know the computer lights to affect our sleep and keep our mind going, and to where we can't fall asleep as well. So no tech, no screens, at least 2 hours before bed. Optimally much sooner than that, keeping a regular sleep cycle, eliminating caffeine, especially in our elderly guys. That decrease in kind of natural decrease that we tend to see, not all, but tend to see for the creatinine increase and our GFR decreasing, and that renal function decreasing overall. That little bit of caffeine can go a long way, especially if you think about decreased renal function and the fact that the half-life on caffeine is, I think it's 5 or 6 hours. It's quite a bit. So somebody can come to me and say, I've been drinking coffee my whole life, and that's not what's bothering me. I said, well, but you don't have the kidneys that you do right now for your whole life. So that could definitely be a part of it. But sleep hygiene, I got off a little bit tangent. There's a whole nother conversation. We can have a whole nother CMA. We can probably talk for a full hour on sleep hygiene, but making sure that we are the interactional tone and everything, how important that is. Adaptogens. Ashwagandha is my favorite. Steps is another one. It's a mushroom based. It is really good as well. Even, just having that kind of in a regular, even a daily routine. I mean, there's a lot of nutritional shakes and those type of things that have them in there. You do have to have, it does depend upon the quality. Some quality is different. Magnolia officialis, Macoba, rhodiola, rhodiola. It's very similar to the disease, but it's not. Common herbs such as calamine or for individuals. Button, but my screen is, I guess it's just not very great. Lowering cortisol, L-theanine, especially if somebody has been under chronic stress for a long time. Our body uses L-theanine to adapt to stress. So if we've been under stress for a long time, more than likely someone needs the L-theanine. Phosphodiesterylcholine, magnesium. Magnesium is really great. It can also help people sleep. It can also help with constipation, especially if they have like a GI interaction there. But at the same note, obviously, if someone has loose bowels, be careful with magnesium. Overall adrenal support, vitamin C, B vitamins. Sometimes B vitamins can be overused is what I meant to really say, but they can be overused. And actually, if you have too much B12, that can actually be neurotoxic. So it's protective in the healthy range, but we get too much, it can actually cause the opposite and cause more fatigue. And I like to screen those, even though B12, especially because B12 isn't everything. People look at it like it's for you, right? Because the diphosphorates in that, like, they're actually outlawed in California. Woo! Go California for that. I really digress there. Sorry, y'all. Remember we talked about not having enough sleep and that affecting your hippocampus. So, and I am a little sleep deprived. Okay, so exercise, especially in the morning, we've talked about that already, DHEA supplements, and treatment may take 2 to 3 months for us to really see an effect. So keep that in mind and let people know that, hey, this mess was not great overnight. It's not going to be fixed overnight. And this isn't just like we took a hit of caffeine. So it's going to take some time. And let's look at our time here. I just want to show, because I want to have plenty of time for our specialist. Okay, so this is a really, you know what? Okay, Instagram people, I'm going to switch this around for just a moment so you can see this a little bit. I'm sorry it's not going to be as clear for y'all, but so you can see it from my end on this side. So the steroid pathways, I just want y'all to see, we're not going to go into this. Obviously, we could speak on this for probably at least 8 hours, but you can really see how like DHEA, where whenever that gets, you have that pregnenolone steal, right? Here's your pregnenolone, right? You have that steal, you see how in cascade is there, and why testosterone and estrogen, which are downstream on that, get affected. Our people tend to come in and think that they just need to, take a shot of testosterone. Well, if we're not fixing this problem up here, like that's just going to be a short-term fix. And often our body is still going to it's still going to break down because you're not going to be having the right even estrogen there. So and you can also see how, that makes a big difference in our overall health. Just focusing on that, on decreasing so here's your cholesterol, pregnenolone, decreasing that pregnenolone steal from happening can make a big difference in our overall hormonal health. And I think people tend to take that as if they want something harder and stronger and faster. And really, like, that plays a really huge part in it. It's very substantial. And people tend to not think. And then you can also see, maybe it doesn't. I thought that it doesn't have the thyroid cascade on this one. Adrenal. So this is precision analytics of the Dutch test. So this is another test that we use often in functional world. Where this is from explaining it. So I think we talked. I would love to hear, like, drop it in the chat for just bonus points of interacting. I would love for you all to share, like, how did you see up opportunity for this medication reduction specialist? I think this is maybe a sub-certification that we're going to start building out in our program, because I really think that, decreasing the amount of time people are on, which testosterone, I know controversies, people say it's for stroke. I don't know. Practice a lot of young people that I don't think they should be having a stroke, and they're on testosterone. A lot, but I have seen it happen a couple of times, and I personally think that's a lot. So, like, decreasing the amount of hormones that people need, giving them injections. And we know, there's a lot of controversy around estrogen, testosterone, all that, but decreasing that, or thyroid medication, helping people get off of, a lot of people think that Synthroid has to be forever. It doesn't have to be forever, and you can wean people off. Or, if somebody's not severe, some people won't even start it on necessarily, even start them on that kind of medication, functionally and intervene. Consider the GI map as an overall stressor, allostatic load from a functional. You should be looking at that. We'll talk again about that, if you haven't seen any of our CMEs on that. GI health is a really big thing about it. And we're actually going to hopefully have one of our specialists come on and talk more about that. And then mitochondrial dysfunction. So we can talk about treating mitochondrial dysfunction. I did a short little reel over it not too long ago, but let's go ahead and bring on our specialist here, our experts. Hello, darling. Hold on. Actually, how do I get my slides off here so I can just see us? Okay. And I don't want myself bigger. Can y'all see me bigger? Because I don't want me being bigger. Oh, wait, there we go. Yay. Good deal.
Hey, how are you?
I am good, sister. How are you doing? I'm going to switch you around here, and we're going to see, I'm going to hold the Instagram here. I need Instagram. I need you to start integrating better with other live platforms. Okay. So this is Portia Brispy. Did I say your name correctly?
Yes.
Okay, good. I just wanted to make sure. So like the first like 2 weeks of meeting each other, I was calling her the wrong name, and she was too polite to even correct me. But she is also a practitioner, so she is medically trained, conventionally trained, and then one of our functional integrative medical practitioner students. So she is both trained and has lived at her and gone through a lot of us have, especially if you're a nurse. Most of us have gone through a level of adrenal fatigue where we can say, I relate to that. Like I relate to the symptoms that she's talking about, or even I have a lot of the downstream things because I've been dealing with it for so long. She has a story herself, and she loves helping specifically mothers who have, because they have, as a very incredible subset of individuals, we go through, our bodies go through a lot of physiological stress that's different than anybody else can. If you've had children, psychological stressors. So just what do you feel like is one of the most, I didn't tell her I was going to be asked questions, so I'm not going to put it back. You're like, thanks so much. That. What would you say is part of motherhood that can cause chronic fatigue, whether it's true adrenal fatigue or chronic fatigue in mothers that is overlooked, or we kind of like push through? Like what do you think is the biggest factor that cause it?
I would say, and I have my story, my own story of why I got into functional medicine, but I would say the biggest thing is just overlooking the demands that motherhood puts on us, how much responsibility we have as mothers. And actually that kind of leads me to my story. I have a couple of stories, but the main one is just, I have 3 small kids, 5, 3, and 1. So, they're pretty demanding. And, just over the course of taking care of kids, I just didn't feel like myself. And I was just like, something's up. And so, I went to my doctor, and I'm like, can you draw labs? And I need to figure out what's going on. So he drew labs, and he was like, well, Ms. Brisby, everything looks pretty normal. Your iron's just a little bit low, go take an over-the-counter supplement. And I'm like, no, that doesn't sound right. I'm like, now literally I was like, my arms feel like they're tingling, like I'm not sleeping, like something is up. And so, I just got to the point to where, and like what you mentioned earlier, my kids are in daycare and school. And so I was just getting sick constantly. And I was like, something has to change. So, I just dug deeper and, went more towards the functional realm and looked at, my labs as how can I get to an optimal level to where, I feel good, and not, the labs say everything's pretty normal. So, just we'll watch it. That's where I kind of feel like in functional medicine, it kind of picks up where conventional medicine ends. It takes it a step further and just really kind of tries to get to the root cause. And so, definitely I feel like after, getting to the root cause, figuring out, what was optimal for me, blood work wise, and just, the way I felt, I'm much better now. Definitely, like I said, with motherhood, you have more responsibilities. So, you have more stress with that. You have less sleep, you have more worry. And so you just, over time, you just get more and more stressed, and the more stress leads to more fatigue. And then, next thing you know, you're like running on fumes.
Yeah.
So,
exactly. Yeah. And especially if that stress continues and you're like many of us, you go to sleep and you're constantly reeling. And then cortisol, like we showed, just like being a little bit high can keep you up. And then what happens whenever you're sleep deprived? You're more stressed. Horrible cycle we can get caught into. Absolutely. Yeah. And I think especially whenever you spoke about, there's so many stressors in being a mother that we don't even really recognize. Like I saw this really great meme, and it said that you lose, I think it was a meme. It wasn't a thing, but I thought that it validates as parents, it wasn't just right, forgetting about you dads, but moms, especially breastfeeding, you do tend to be the one that loses more sleep. It's just how it has to kind of happen a lot of the times in a lot of scenarios.
Definitely.
But you lose like 6 months of sleep in the first 2 years.
Definitely.
That is just, it's so hard and that's so true. And that as the psychological stress and, what about, I mean, do you see it being prevalent, the stress of worrying about kids and that adding to the syndrome? Adding to the
I definitely feel like it's the stress of worrying about the kids, worrying about if, finances, depending on what your household situation is, and if you're a working mom, worrying about your work, so I think
your
all
work
of
and
that,
home and yeah. Mm-hmm.
I think all of that plays a part. You go to work because you're trying to provide, but then you want to also get that time with your kids. So, then you're stressing about having that time, and so it's a big cycle,
It is.
and you kind of have to get past the, well, you're a mom, so that's just, you have kids, so that's just how it is. That's just what what it's going to be,
Right.
and to realize that, there are steps that you can take to get, out of that fatigue, to get out of that burnout, to get back to, being able to just enjoy time with your kids and family,
Yes.
and not feeling like you're a burden on them because, you really want to say no, but, you go ahead and say yes because you're the mom, you're the shero.
Yeah, exactly.
Yeah.
Right. You have to you really have to start prioritizing that. It's just like we use an analogy a lot where in a plane wreck, right? The oxygen drops for a reason, it drops for a reason, obviously, but you're supposed to put it on yourself first before the kids
Right.
for a reason.
Right.
And we just look past that so much. Okay, so let's get a little bit controversial. Where do you see the gaps in conventional medicine? So I'll actually just preface this with one of my biggest pet peeves is I see a lot of, because we don't have a conventional medical background or answer, just like you said, everything looks fine. The medical labs look good. So I see a lot of people say that, it's in their head, right? Like that's what I see. And I hate that. I don't like the word either. I don't try to use the H word, but it never sits well with me whenever I see a practitioner kind of chalk it up to, it's just kind of in the patient's head, because I always believe that their experience is real. And there's obviously some scenarios where that's always the case, but for the most part, that's my personal, it's always been my personal default that we're missing something to explain it, but we're definitely missing something for them. So where you specifically that conventional medicine kind of drops. We're not here to bash conventional background. We're really at our truest, but both have functional and conventional and have their fallback. So what would you see as that?
Well, like you said, prior to, doing integrative medicine, that, that wasn't fully me, but that may have been, part of me, just kind of looking at the labs and, saying, well, everything looks good here. I don't really see, what could be causing you to be, anxious or depressed, or what could be causing you to be, fatigued. Your thyroid looks fine, or why your hair's falling out. We'll watch and monitor and take some vitamins. And, then when you get to the functional side, and you start to integrate both, you look at like I said before, the missing gaps and what's optimal, not what's the standard range for, the standard American, but what's optimal, for you.
Exactly.
And then, so I think definitely, just with conventional medicine and, a lot of times insurance, you're not wanting to, run certain tests or look into certain things because you're worried about the insurance, or, patients are so stuck on, will my insurance cover this, or, and like you've said before, what's a few, $100, or what's a bill from the insurance versus, hospital stays or, medicine for the rest of your life. You have to weigh the risk and the benefit of that. So I think definitely with a conventional, they are more of a, money model, and they kind of lack the, let's go beyond that and look at, what's optimal for
Yeah.
each individual.
Like, there's a lot of, oh gosh, we're still here. There are values and normal ranges that are sometimes, I think, favoring not us as providers, getting kickback. We don't get kickbacks in the that I'm aware of. I guess apparently there is some places. I saw somebody talk about, and I'm not trying to throw rocks, but in psychology, I don't know if that's any true at all. I don't know if it's true at all, but somehow they get kickback for prescribing certain things. I don't know. So we don't get kickback as providers, but I think that there's a lot of bias in that if there's not necessarily, if we're not pushing them towards a certain medication sometimes.
And even, just being in integrative medicine, now, I hate to have a mom who, she's in her 30s, and now she's, she has kids, she works, and she has anxiety now. She's having a little bit of depression now. I hate to just throw medicine at her and say, well, let's try antidepressant medicine, especially when she's coming to me and she's like, well, I really don't want to be on antidepressants. I really don't take medicine. I just want to figure out, why am I feeling like this? I just, with functional medicine, I feel like you can offer other options. You can, offer insight into what else may be, the reason.
Yeah. I'd sometimes get questions from patients. They'd say, why did this happen? I was like, that's essential. We don't know the cause. Like, let's be like, as an example, right? Like, we don't know. Yeah, no, I think you're definitely right. And whenever I was, first practicing, one of the first things I did, and I learned I learned SSRIs, SNRIs, and the pathophysiology behind them, like kind of trying to understand, this person low in dopamine, are they low in serotonin, and which medication I should do based on that. Because I kept on getting a kickback of huge, like, people would constantly come back to me and they would feel sick and the medication. So I learned the pathophysiology better. So then I became better at it, and I had less people come back with side effects, and they did better with them. But then it never really, it always got to a point where I had to increase that medication, even if I was able to find the right one that worked best for them off the bat. I had to increase the medication, and rarely, unless it was substantial depression or anxiety, would take them off of it. With such as, like you're saying, like with adrenal fatigue or hormonal imbalances, or even GI health. And we'll talk about that, in other CMEs we have already, but about how, that makes a big difference on their depression and their anxiety. And people don't realize that, there's scripture. Right. I'm going to get off a little bit. You went off a little on this. I'm going to go a little bit, and then we'll probably close it down today. But, there's scripture that says that their God's in their gut. People always think about that as a gluttony. I personally see that as 95% of our serotonin is in our gut.
And definitely. How when when your stomach is upset, or, you're not going to the bathroom how you would regularly, and then you just start to get, just sad and depressed and anxious, and you're like,
Exactly. Ever function, you'll hear this. One of my first things, I quit going to, especially like Asian phase. I love it because I was trying to get out of just eating French fries all the time and eat like vegetables, and those places have vegetables at them. So I ate them all the time, but I started recognizing real quickly that I feel depressed every time I leave there. Mm-hmm. And part of that, there was more than just one thing going on there, but a large part of it was the gut dysbiosis. And then another part was the MSG that was in there, and those chemicals making a difference, and how much of a difference that makes. And it was like our saving grace. The last time we went, I don't think Gage was here yet, but my husband said he felt really down, and exactly what he said, or his words, I don't feel good. I do not feel good. I think they overdosed the MSG. That I say overdose, but they used too much of it. But yeah,
and what I would definitely say in conventional medicine is they a little bit different from the functional side is that they don't teach you, that philosophy of, like you said, your health starts in your gut, your immune system starts in your gut. We're always treating the symptoms,
Mm-hmm.
and we're just trying to manage that.
Yeah.
Definitely with functional medicine, it's more getting down to the root cause, trying to figure out why is this happening? What's
Mm-hmm.
causing this to happen?
Yeah.
So I think, just from me just not feeling like myself, and, after learning and integrating, functional medicine, it was like something is up and I need to figure it out. And even with my youngest son, he's been having eczema flares, and, and so it just brings me to, like you were saying, the gut health. We need to make sure that our gut health is good, even if, with him, we're not doing a lot of testing and all of that, but just making sure he's on probiotics, making sure, we're incorporating, those fibers, making sure, we're staying away from those processed foods. We hear it all the time, but it's hard. It's hard.
It
So,
is. Sure.
one step at a time, one day
Yeah.
at a time. And
Yeah.
it
No, I
works.
think you brought up a whole bunch of really great points, and many of them I kind of wish we had more time, but do have to get out of here. I want to try to keep these to the 1 hour, because nobody wants to be like, this is a 2 hour. Let's take 2 hours, and I'm gonna get one CME on this. So what I do want to do, though, guys, before we end here, is I am going to be my tech person. And where is, okay, so if you want to, let's show this one right here first. So you can go to https://bit.ly/tired mom info. Okay. And that is going to get you to be able to connect with our experts. And I'm trying to hold phone on Instagram, so I'm looking down Instagram so you can see that really clearly. I'm trying to be really still so you can see that. It is case sensitive, so you do want to make sure that you capitalize those, but you can opt in and she'll be able to get you free resources, if I could speak, and help you in that way. If you're somebody this really resonates with you,
Yes.
and you need help in that way, guys, like, reach out. I'm telling you, she's an incredible human. Very,
Yes,
very personal.
I've been there.
There, she understands. So, no shame in this. Even if you're just somebody who you're like, I don't even know how to decrease this stress. Like, how do I even start on this journey? And it doesn't have to be, you may not necessarily think that I have specifically adrenal fatigue. Don't even try to self-diagnose yourself. Just, if you're having these issues, reach out. She has some really incredible resources going on, and some really great groups that'll be coming up, and she's going to be helping people at a large scale level for, really just nominal intervention, like your costs, and she
Yes.
can get you towards and stuff. So reach out first, and then for CME here, we are going to. Oh well. I guess I didn't hit save. Sorry, y'all. I'm a little tech confused sometimes. So this is the bit.ly. It's the same / there, and the bit.ly / adrenal CME, and then you can get your CME. It will be free for the first week, and then, or at least 72 hours, and then it'll be switched to like a really low cost. It's like $10, I think, an hour, $10 per hour, which is still really low for CME. After the 72 hours, but I always allow 72 hours from the replay from whenever I send it out to everybody. So if you're on my email list, you're going to get that information sent out to you personally into your inbox, all nice and neat for you, so you can have it and save it. And then if you want the CME for free, you have 72 hours after I send it. So it'll probably be and let's see. I think that's the application. Actually accepting students at this time. If you want to get onto the wait list, and you'll want to drop an application there to the bit.ly /IFN application. That one's a little bit different, bit.ly. You maybe need to put in the HTTPS, but it's not on there, so maybe you don't with that one. But we're not actually accepting new students at this time. But if you want on the wait list, then that's where you would drop an application for that. And I think that's it. So thank you so much for joining us.
Thank you.
And really really great. I know everyone's going to have some really great takeaways from this. And again, guys, just reach out if you have any questions, or we love hearing from you. So y'all have a great day and many blessings.
Thanks. Bye, Lauren.
You're welcome. Bye. Thank you.